Hi folks, welcome back. Got a lot of questions to go through. I'm going to start here with Dan from Sweden. He asks, my question is that you said in a video that if having cancer at a dose of 1 milligram per kilogram of body weight would be best at a start to see where things are. For me, that would be like taking 25 capsules containing 12 milligrams of a competitor's product per day. My weight is 85 kilos. Well, that's a lot of astaxanthin. Or is Volasta more powerful than the capsules we have in medical stores here? Bottom line, it's not even comparable to the astaxanthin that is available in Sweden. Sweden has the pure astaxanthin molecule minus the glucose attachment to it. So when they do the extraction process from the algae to obtain the astaxanthin, the raw astaxanthin is actually in a glucosidic form or a liposomal form, which means that it has a glucose molecule or a fatty acid molecule attached to it. But in the process of supercritical CO2 extraction, which is the major process, that glucose and that lipid is cracked off and it's no longer available. So having pure astaxanthin is not necessarily good. It's not as absorbable in the small bowel. The little cilia in the small bowel don't take kindly to it as well as the Volasta astaxanthin. Now the primary difference is that Volasta has the reattachment of the glucose or the lipid. We put that back on to make it more in line with the natural product as it exists in nature. When we do that, the absorption rate goes up, by a factor of 8 is what we've been able to find. For example, if I took 100 milligrams a day to stop my cancer, which is an actual experiment that I performed back in 2008, where I was actually eating the algae itself, and I was taking an equivalent of about 100 milligrams a day. When I began to use the astaxanthin that you find in pharmacies or drugstores or Walmart or wherever, my cancer came back. So what I had to do was keep increasing the dose, watching my liver to make sure I wasn't doing anything, having any side effects. I got all the way to 888 milligrams before my cancer turned around and started to regress. So when I was eating the algae, I was only required to take 100 milligrams per day. But if I switched to the more pure processed astaxanthin, I was all the way to 880 plus milligrams to get the same effect. So that's a factor of 8. So that translates directly into the Volasta, the glucosidic form or the liposomal form, where the lipid is actually attached, chemically attached to the astaxanthin molecule, or the glucose is chemically attached, not just a mixture, it is chemically attached to the astaxanthin molecule. That's what our patent is based on also, is how we do that. It's 8 times more effective. And basically the cost per milligram is the same for the same treatment. So I hope that answers the question. It's all about absorption, and Volasta is 8 times more absorbable than the current astaxanthin on the out in the market. Paul M asks, I have lung nodules in both lungs. How does Volasta affect them? I'm on 11 pumps at present for Parkinson's. Also, my breathing has been affected. I have never been tested for COVID, nor have I taken vaccines. I do not know if the two are related. Okay. Lung nodules can be benign or they can be cancerous. Only about 3 out of 100 lung nodules ever become cancerous. So it's, from a probability point of view, it's very unlikely that the nodules are malignant. Now, Once a nodule gets larger than 3 centimeters, maybe, I think is the protocol that's used for that, they call it a mass. But what causes these nodules? These nodules are caused from some sort of inflammatory artifact that happens in the lung. It can be from smoking. Typically, that's where they originate. But in non-smokers, they can be, let's see, here we go, past infections. Each time you get pneumonia or have a cold in your lungs, it's going to leave a scar tissue. That scar tissue is going to show up as a nodule. Usually calcifies, by the way. And it will show up on a CAT scan. Blood clots, coronary blockage, pulmonary, it's supposed to be hematoma. If you have a blood clot, this is what happened to me when I got COVID the first time. I had a blood clot hit me in the left lung, and now it shows up on the x-ray as a fairly sizable mass, but it's caused from a blood clot hitting me there. So if someone has coronary artery disease, there's a good chance that they'll be showing up with these nodules in the lungs. Inflammation. Anytime that you have an irritant in your lung, and these nodules will show up because the inflammation creates a response. That response will create a scar, and you'll have that. Typically, these nodules are not life-threatening, but it is something you want to watch. If it doesn't change over a 6-month period of time, then it's benign. If it does show change, then it needs to be looked at pretty quickly, because these nodules should not be changing their shape. So that's something to watch for. Has Velasta, Marilyn asks this, has Velasta been used by patients with myelofibrosis? It is currently being used. The issues here, this is a disease of the mutation of the bone marrow stem cells. So what we want to do is look at what's causing this mutation in the stem cell. It's not strictly genetics. This was the same problem I had with polycythemia. I had a out of control stem cells producing too many red blood cells. Some cases now with myelofibrosis, it can be white blood cells, platelets, any of the blood cells that are produced in the bone marrow. Now, what causes these stem cells to go awry is typically from inflammation, systemic inflammation. It's the single largest culprit to stem cell malfunction. People who have a genetic predisposition, this can be, manifest very quickly. But just having a genetic predisposition does not mean that you're going to end up with these types of mutations. If you keep your C-reactive protein less than 3, there's a good chance that these mutations will stop, and you may not be able to reverse the damage that's been done by this, but you can stop its progression. Lynn S asks, please expand on what the allergic reaction is actually caused by that's in shellfish. You say it's not actually iodine, but another allergy that I couldn't think of on the last question and answer session. Tropomyosin is the protein that I was trying to think of. There's a couple here. There's tropomyosin and parvalbumin. I'm not so familiar with that protein, but that's another one that they say that people have a sensitivity to. But tropomyosin is the one that is typically making people have allergic reactions to shellfish. It's not necessarily the iodine. So I don't know how to test for that. You can ask your doctor about it. But that's typically what's giving people rashes. The shock that people go into when they have an allergic reaction to this. Vera S asks, in your previous videos, you mentioned that oxygenating blood by deep breathing is a positive thing and doesn't create free radicals. What about IV ozone therapy or drinking ozonated water using infrared ozone saunas? Would these be also okay if someone is on Velasta protocol? And what creates free radicals? Okay, I'm going to differentiate here between breathing and exogenously adding free radicals to your system. If your oxygen level dips down into the 92 to 94% saturation range, you need to be breathing. That's creating an anaerobic situation in your body, and it's causing your mitochondria to generate even more free radicals. So deep breathing should happen to raise your oxygen saturation to somewhere between 96 to 98%. You want to maintain your oxygen level in your blood at that level. That's completely different than adding free radicals to your body, which is what ozone is. And our mitochondria in our cells produces free radicals. The OH free radical, for example, is used as a communicating free radical. I believe it's in the processing of NAD to NADH, in the production of ATP, or the conversion of ADP to ATP. So we can't get away from the production of free radicals. It is a byproduct of our little manufacturing plants called mitochondria that are in our cells. And it's just a waste that we have to be able to manage. If we don't manage it properly, free radicals never leave your body unless they're converted into ions. Now the difference, and I'm going to get into a free radical versus an ion. Let's take the hydroxyl free radical, which is probably the most dangerous one we have. What the oxygen and the hydrogen that's attached to that, if you counted the protons in that whole molecule, you would find that it has an equal number of electrons around. So protons are a plus charge, electrons are a negative charge, so it has an overall charge of 0. Now, what makes it so reactive? What makes it reactive is that electrons have to exist in their orbitals in pairs. And typically, the way we think about it in chemistry is one electron is spinning clockwise, the other electron is spinning counterclockwise. And that's called the conservation of angular momentum. There's a whole bunch of ways to look at it. But when a OH radical has two electrons spinning the same direction, they have to be separated. So the OH zero charge is looking for an electron that has an opposite spin to fill the orbital. But when it absorbs that electron, electrons have a -1 charge on them. So when it absorbs that electron, that OH zero charge becomes an OH -1. It has one excess electron to pair with one of the electrons. Now it's an ion. Ions have charges. So the OH -1 is an ion. An OH with a 0 charge is a free radical. A protein having unpaired electrons is also a free radical. So the reason free radicals stay in our body is because when a free radical, let's take the hydroxyl free radical, bumps into the DNA, it will extract an electron from that DNA, and it will become an OH -1. Well, that DNA that just had its electron is now a free radical. And it's going to go through a whole bunch of three-dimensional maneuvering trying to resonate that change in its stability. That's called a mutation. That DNA has now been mutated. So when the RNA is read from the DNA, say to produce an insulin protein, it may not read properly. Or that DNA hopefully will cause the cell to die, but in cancer cells it doesn't. The cancer cell goes anaerobic and begins to function as an immortal cell. But free radicals, we measure C-reactive protein, and it's a measure of our inflammatory disease state. If we're alive and functioning, we will always have free radicals coming from the oxygen. If somebody is injected with ozone, ozone is a free radical. Why would anybody take on more free radicals when we know how damaging they are? So that becomes a problem. You don't want to introduce more free radicals into your body. There's a detrimental outcome to that. So introducing free radicals is a pretty serious game. So I am not a proponent of ever adding ozone to your body or introducing anything that would increase the concentration of free radicals. AskSam S asks, could Valasta help in the case of rhabdomyosarcoma in children? This is a pretty serious cancer, by the way. Recommended dose, and does it help taking it along with chemo and radiation? Is the RBS will still require sugar or glucose as its primary food source. So what happens is when we introduce glucosidic astaxanthin to these types of cancers, that glucosidic astaxanthin is sucked intracellular into the cell because of the glucose. The cancer needs the glucose for energy. It's called a Trojan horse. Now, once inside the cancer cell will split the glucose off of the astaxanthin and use it for energy. The remaining astaxanthin is now going to donate electrons. Now, with this cancer in particular, the exogenous area, the area around the cancer itself, has a relatively low pH. It can vary anywhere from, it's acidic. It can be from 5.8 to about 6.8, maybe 7.2, but typically it's acidic. Now, what's causing that acidic is two things in these types of cancer. The first one is the hydroxyl free radical. The hydroxyl free radical, having a zero charge, is what's called a conjugate acid. It's looking to accept an electron, and acids accept electrons. So it's going to lower the pH of its environment. The other key component that it produces is called lactic acid, and lactic acid will lower the pH. So when we introduce Valasta into these types of environments, the Valasta that's left has a huge concentration of donatable electrons. So when it donates an electron to an OH having a zero charge, that OH is converted into an OH minus 1 charge. The pH of that change from OH zero charge to OH minus 1 is a pH change of, say, 6 to well over 11 inside that cancer cell. That cancer cell will die in 4 seconds. That's how we now believe that the glucosidic form of astaxanthin does an intracellular kill of the cancer cell. The astaxanthin itself will also react with the tyrosine on the PD-L1 of the cancer cell and inhibit the PD-L1, which will allow your immune system to kill the cancer cell. So we have two mechanisms of kill. So one, if it's PD-L1 positive, we can inhibit the PD-L1 and cause your immune system to recognize and kill the cancer cell. These types of cancers are cancers that we trick into feeding them a poison that will eventually kill them with no side effects. When the pH of these cancer cells go much above 8 or 9, the phospholipid membrane around the cell will start to come apart. But in these cases here, the OH-1 shoots the pH well over 11 with bad consequences for the cancer. Can you take it with chemo or radiation therapy? Chemo and radiation will generate a huge concentration of free radicals. So it's a different mechanism. But we now have hundreds of people who are taking Volasta with chemo and radiation, and it softens the chemo effects. If you just did chemo or radiation, you would get a regression of the cancer that follows a very specific slope on a curve. If you take Volasta, the slope of that line can more than double. So there is a synergistic effect of using Volasta along with chemo and radiation therapy. Always measure that child's C-reactive protein. In that child, that number should be under 1. If it's not under 1, put them on Volasta and get that number down as quickly as you possibly can. You may then see the RBS will start to regress, and the inflammatory disease state will dramatically decline. No sugar, except for Volasta, because there we're using it as a weapon. And the Volasta will kill from the inside on these types of cancers. It's called intracellular death, really. Candace P asks, will this help with my father suffering from high blood pressure, high cholesterol, sleep apnea? Second is my aunt. She has very bad arthritis, is wheelchair bound. She is a strict vegan for many, many years. Third is for myself. I suffer from lower back problems. I have a bulging disc. Suffer from occasional migraines. My feet and legs hurt as if I had a hard workout, especially in the mornings. I'm just in poor health. Okay. First of all, I'm going to start at the back and work forward. Poor health. Poor health is not defined by how you feel. Poor health is defined by your inflammatory disease state. So everybody should be running a high sensitivity C-reactive protein, and that number should always be below 3. Now, how do you get it below 3? Well, first of all of these symptoms that you're experiencing are all inflammatory. Probably caused, you probably have fruit in your diet. You may have alcohol in your diet. You may have sugar in your diet. They're all inflammatory. So we have to eliminate, from a diet perspective, those things that are adding to your inventory of these reactive oxygen species. So the first thing we're going to do is change your diet. No fruit, 0, no sugar, no alcohol, no smoking. All of those are free radical generators. And if you can't eliminate those, Volasta is not going to offer you any form of relief, because that is the cause of your disease. Now, once you get those things under control, we need to focus on getting your systemic inflammatory disease state under control. Valasta will bring that number down dramatically. For example, with arthritis, in 3 to 7 days, you'll notice a huge difference if it's inflammatory. If it's mechanical or if there's bone on bone, Valasta isn't going to help with that. But you will see, because having arthritis is a constant inflammatory disease state. You end up with fluid around your joints. So there's a whole bunch of reasons why this protocol, the Valasta protocol, will work. Valasta isn't going to help with that. But you will see, because having arthritis is a constant inflammatory disease state. You end up with fluid around your joints. So there's a whole bunch of reasons why this protocol, the Valasta protocol, will work. And it works quickly. In probably 7 days, you may even be pain-free, but you'll notice a remarkable change in your pain level. Candace, with your father, he suffers from high blood pressure, high cholesterol. The high cholesterol is probably LDL cholesterol. It's coming from fruit or alcohol, not from animal fats. The doctors are going to treat the symptoms and give you Lipitor or some other statin medication. Sleep apnea would also tell me that he's a little overweight. So I would focus on his weight at this point, but I'd also run a C-reactive protein, and let's get his inflammatory disease state under control, and he'll lose weight with Valasta. No sugar, no alcohol. These are major changes that people go through. For example, the way that it works when we're younger, we have glutathione as a cellular antioxidant. It only works inside the cell. You cannot get glutathione from your bloodstream into the cell. It has to be produced by lysine or isoleucine in the cells. But we generate a lot of eating habits, alcohol consumption when we're younger, and our glutathione level keeps us from getting diseases when we're young. Well, the problem is we don't change our habits, but nature cuts off the glutathione production. In women, it's age 42. In men, it's age 50. So it's nature's way of taking us out. We've generated very, very bad habits. We were protected or somewhat protected until we get those habits so fine-tuned we think that we're okay. Then all of a sudden what was keeping us healthy goes away, but we never change our habits. And that's when we get heart disease, we get cancer, we get arthritis, we get Alzheimer's, we get Parkinson's, MS, irritable bowel, Crohn's. So change your habits. You've got to be willing to do this. So now you know how to do it. Now it's a matter of execution. Melissa asks, I'm considering Valasta astaxanthin for my 16-year-old daughter with metastatic Ewing's sarcoma. Does anyone you know of with this cancer use Valasta astaxanthin? I don't. That doesn't mean that there isn't anyone. I'm just not aware of it. If so, this has been successful in keeping them in remission. She was diagnosed in September 2020. She had a tumor in her back, multiple lesions on her spine, nodules in her lungs at the time of diagnosis. The tumor caused severe trauma to the nerves, and she was paralyzed for several months following surgery to remove the tumor. She relearned to walk and underwent nearly a year of chemo and radiation. She was declared in remission for 9 months before cancer returned to her lungs, and she was started back on chemo. She had not yet regained full feeling or movement in her left leg before the cancer returned. Her current chemo is effectively eliminating the cancer, but is also damaging her compromised nerves. She is on gabapentin for nerve pain, but there is nothing the doctors can do to stop the loss of feeling. She loses more feeling in her leg with each chemo cycle. And she will. Chemo doesn't differentiate between normal cells and cancer cells. Does valastaxanthin help protect and or heal damaged nerves? Okay, before I go on, I'm going to answer that. Typically what happens is there's a sequence of events. So you have the antagonist that is introduced into the system. It goes through a series of steps, generates a huge concentration of these communicating missiles called free radicals. And then they go in and they start doing their damage. So it's still all about inflammation. Inflammation is what causes these nerves to be damaged. If you stop the inflammation, these nerves should stop. So there's no side effect. There's no reason not to do this. Okay, now I've listened to some of your Q&A on cancer, but not all. I remember you saying that when cancer dies, sometimes can appear that the cancer is spreading on scans. How long does this usually last? My daughter has been and will continue to be scanned about every 12 weeks, and I'm also wondering what to expect if these areas are biopsied. If they see a spot in her lungs that is essentially dead, Ewing's sarcoma cancer cells, they go in to biopsy this spot. Do you expect a pathology report to identify and diagnose this correctly? Or is there some chance the pathology will show Ewing's cancer cells and there isn't a distinction between if these cells are dead or alive? A couple things. The pathology report is very good at being able to identify these cells. Scans, on the other hand, cannot differentiate between what's inflammation and what's cancer. They both, especially with contrast, they both take up sugar. So they'll both light up, even if it's inflammatory. Now, when an oncologist sees that light up, he must, by his protocol and his training, assume that that's cancer. It may not be. It may be an inflammatory response. But as a result, he's going to specify chemo or radiation when in fact he doesn't know for sure whether that's cancer. To me, that's a problem. And that needs to be understood and clarified. Now, when they do a biopsy, they can go in and look at those cells, and they'll be able to determine whether those cells are viable, necrotic, or active. A path report is always a good source to look at. But the pathologist must also be trained to know the difference between a cell that is inflammatory and or necrotic, and be able to report that accurately. So there's still some questionable things here that we have to watch, and it depends on the quality of the pathologist. Typically what happens is, for example, with Valasta, when you go on this, your CA numbers, if you just let cancer progress, it follows an S-shaped curve or an exponential curve. And that's pretty well, that can be predicted. For example, you start out with a CA19 of 30, and then 2 months later it's 60, then 2 months later it's 120, 2 months later it's 240. And now you've got to do something, because that's a very strong indication that there's viable cancer in your body. Now, when you go on Valasta, and this is something oncologists have to be retrained about, you start out at 30, go to 60, you go on to Valasta, your CA number might shoot to 600. And that really freaks out oncologists. But the reason that CA number goes so high is the cancer cell dies and the guts of the cancer cell flood the the cardiovascular system. And it gives a very false positive, because that's coming from the death of the cancer cell. So what we look for is the bend over. So once the CA number goes to 200, 300, it might go to 320, and then all of a sudden it's 180. Once you bend over, then you're winning. The cancer is not progressing, and now it's a matter of months before all of that debris in your body will be taken through your lymphatic system. And if it plugs up your lymphatic system, that can be another issue where you'll see some swelling in your lymphatic system. But if your body cannot dissolve it, and if the tumor's too large, then it will push it out of your body, similar to a boil. Is there some chance the pathology will show Ewing's cancer cells and there isn't a distinction between if these cells are dead or alive? They'll be able to determine whether the cells are dead or alive. They can even grow cultures of those cells and see if those cells are still viable. Throughout this entire cancer journey, I have not seen her CRP has not been elevated. That's not always a good thing, and I'll explain why. I noticed that this is something that was frequently discussed in conjunction with cancer. Her CRP has never been elevated. It is currently 0.4 and has been close to that through these last 2 years of cancer treatment. Now, I want to make sure we're talking apples and apples here. Some labs will report their CRP as, in this case, 0.4 milligrams per deciliter, mg per dl. What I'm referring to is milligrams per liter, mg per L. So if this was 0.4 milligrams per deciliter, you have to multiply that number by 10. So she would have a CRP of 4 milligrams per liter, which puts her above 3. So make sure you understand the units when you're looking at your blood work to make sure it's milligrams per liter. Now, the fact that her CRP is not elevated means that her body is not recognizing that this cancer is causing any form of inflammation. That can be very difficult because it means her immune system is not going to see this cancer. Now, what will happen when the Valasta goes in and either ties up the PD-L1, and I'm not sure whether Ewing sarcoma is PD-L1 positive or not, but once that cancer cell begins to die, it is going to spark an inflammatory response. Her immune system is going to perk up and want to see what all of this debris is. And so she may get a more realistic reading on her CRP once she goes on Valasta. She might see a spike up. But in these cases here, the CRP may not be indicative of her level of cancer. So we want to use other ways of doing that. One is the path report. The other one is tumor size. One is scans. For example, if you do a scan and the scan shows it to actually be growing, but it's in fragmented pieces, that's actually a pretty good sign. That means the cancer is probably breaking up and the body is dissolving it. If it grows as a coherent mass, that's not a good sign. We've got to be able to differentiate what is actually inflammatory and what is cancer progression. Most of her other labs are within normal parameters, with the exceptions being her blood count when she's 7 to 14 days post-chemo. Her ALK-Phos and ALT are slightly elevated. Her ferritin is like 600, which I understand is due to all the blood transfusions she's gotten. And I would like to know if astaxanthin can help with any of these. Would astaxanthin help rebuild bone? Astaxanthin will help rebuild bone when the cause for the bone loss is due to inflammation. So if we stop the inflammation, and it's a long process, but the body will rebuild bone and start placing. Make sure she's taking vitamin D and maybe a calcium. Her ferritin is like 600. The ferritin it's like a water balloon. It stores iron. Cancer accumulates iron in its cells. So cancer cells have a much higher iron content than normal cells do, typically. Ferritin is a storage vessel. Ferritin is a protein that stores iron in a different state than its Fe+3 state. and I believe it's Fe+2. And the reason is Fe+3 can get into a reaction where when it sees the peroxyl, it will react and produce very high levels of hydroxyl free radicals, which will elevate and actually cause cancer, but it will elevate that CRP number. So her ferritin level at 600 means that she is storing iron in that protein. That's something you want to watch pretty carefully. Her ALK phos and ALT numbers. The ALK phos is alkaline phosphatase or calcium phosphate in the bloodstream. It's a measure of her bone loss. If that number is above 120, it means her bones are dissolving, and the calcium phosphate is showing up in her bloodstream. ALT is going to be elevated if she's post-chemo because that's a liver enzyme, and typically the only way you can get the chemo out of your system is through the liver. The liver is going to enter into an inflammatory disease state, trying to get rid of the chemo because it's a poison. So those don't surprise me. I wouldn't like to see her alkaline phosphatase, being much over 150 really at her age. Ideally, it's going to be less than 120. And if it is above 120, it means that she's still losing bone mass. She is at high risk for relapses. I am eager to find anything and everything to help prevent this. She's about 5'4" and weighs about 107. I appreciate any dose recommendations you feel like astaxanthin could be of significant benefit to her. I would start her off with 100 milligrams per day. And then we want to find a parameter that we can monitor. It might be ALK phos, it might be white blood cells, it might be or just a comparison of her blood work. But we want to be able to monitor the change in her CBC, in her blood count, and even in the metabolic panel. The Valasta will have a tendency to alleviate a lot of the hepatic inflammation with regard to the liver and to the kidneys. So you want to monitor those very, very carefully. There's no side effects. There would be no reason not to do this. It's not going to interfere. She may be able to get off the gabapentin, and I would monitor specific spots on her body as far as where her nerve numbness might be and see if it doesn't start coming back. So I hope that's been helpful. This is a complicated case, but the Valasta most definitely, and you should see changes within 30 days of having her on this. So we'll know within 30 days whether this is going to work or not. Anna D asks, I've been taking Valasta for a few months now. When I started, my weight was 104. I was taking 3 pumps twice a day. I'm now at 114 pounds and have increased the dose to 5 pumps twice daily. I've been suffering from long COVID since August of 2020, intestinal inflammation, ongoing diarrhea, as well as vascular inflammation, and platelet activation and microclotting. I have improvements in my inflammation markers already thanks to Valasta. Prior to COVID, I have been diagnosed with 2 autoimmune conditions, microscopic colitis and Hashimoto's. My question is, in my case, do I need much larger doses of Valasta? What would you recommend? Okay, I'm going to stop there for right now. COVID is a very, very interesting case. As a matter of fact, I have COVID right now. But this is my 3rd bout with COVID. My first bout was pretty serious. But when I went into the hospital with COVID, I had a blood clot that hit me in the left lung. The doctor, I asked the doctor what my C-reactive protein was. He says, let's check. So he gets on the computer and looks up. And he said, yours is 28. And I went, oh my golly, 28. I said, should be less than 3. He says, what do you think the CRP is for COVID patients? And I said, I don't have a clue. He said, a good outcome case is 200. A bad outcome case is well over 1,000. He said, we have 4 doctors trying to figure out why yours is only 28. So it's not the virus with COVID that causes these problems. It's the inflammatory autoimmune response. So if you remove the inflammatory disease caused by COVID, these symptoms should go away. The second time I got COVID, it was more like a flu, and this time it's like a common cold. The Valasta itself, especially with Hashimoto's, we see a lot of major improvements with colitis within 7 days, Hashimoto's within 2 weeks. The symptoms just go away. So if we can control the inflammatory disease state, these diseases don't present. There's no symptoms. Not to say that you may not have this for the rest of your life, but you won't die from it. Keep your C-reactive protein less than 3. Monitor it monthly if you have to. The long COVID problems that we're now having is directly related to the cytokine storm and the activation of interleukin 6 and the breaking of interleukin 10. Both of these can be mitigated tremendously just by decreasing the inflammatory response caused by interleukin 6. And Valasta does that very, very well, by the way. There's a lot of National Institute of Health reports on this, and I would suggest that you take a look at some of the NIH papers. You can Google NIH and astaxanthin and whatever disease you have, and there's thousands of reports now done on this. So this is not something that I am alone in promoting. But now the NIH has confirmed the same results that we're seeing, and it's pretty substantial. Let's see. There's an experimental drug treatment suggested for my condition using Maraviroc and Pravastatin. These drugs scare me because of their side effects. I wonder if I can achieve improvements without taking these drugs and concentrating on Valasta. You can. Those drugs are going to stop the inflammatory response, but the chirality of it, the structure of the molecule itself, mandates that there will be side effects. Hopefully they're minor. Any synthetic molecule that's produces both a left-handed and a right-handed molecule. Same number of fingers, same palm. Only the left-handed molecule works in these cases. The right-hand molecule cannot be assimilated by the human body. That's why we have to eat food, and that's what makes it so remarkable, is that we have to eat living things, because living things only produce left-handed molecules. That's why it's virtually impossible and non-economical to produce food in a laboratory from purely organic chemistry, because half of the food is totally unusable due to what's called chirality. So that's just a little sidelight. You might win in a trivia contest somewhere. Have you seen any improvements in people with long COVID taking Valasta? Absolutely. If you get the inflammatory disease state under control, get your C-reactive protein under 3, the brain fog that usually comes, the headaches, the migraines, they go away very quickly. Within about 7 days of being on Valasta, most people report dramatic improvements in their long haul COVID. Laura B from Canada asks, hi, I was recently diagnosed with grade 1 low uterine polyp cancer, which was removed by hysteroscopy procedure. I've had high blood pressure in the last year, but all else is good. I'm 73, retired at 70, never on medications outside of recent antibiotics for bladder infection and H. pylori. I am on Valasta 3rd week and taking 15 pumps per day. Before that, I have been on supplements my entire adult life, which includes blue-green algae, and since 2004, Zango juice. I don't have sugar or grains in my diet. Is there any value in taking blue-green algae or Zango when taking Valasta? There are some micronutrients that are still in the phytoplankton. I don't know what the effects of it is, but magnesium, for example, is prevalent in blue-green algae. Zango juice is still, I don't know whether it's fructose related or not. I just don't know enough to comment on it. The only thing with the Valasta is that you're going to reduce your inflammatory disease state. Let's do nothing that would increase that disease state. So the best thing to do is keep your C-reactive protein less than 3 and eliminate any more, or reduce the probability that you're going to generate any form of mutated cancer cells showing up as polyps. It doesn't necessarily mean that it would be in the uterine. You'll also want to get your colon checked periodically. And bladder infection, you can also get polyps in the bladder. But keep your C-reactive protein less than 3, and the probability is very, very low that you'll have a recurrence of this cancer. But these questions are absolutely appropriate, and I hope that they've been helpful. Keep the questions coming, and we'll get to it as soon as possible. Thank you all.